everyone to another wonderful episode here at Jaws Podiatry. This is an unfortunate case that we're going to be presenting today. You know, the patient has traveled all the way from New York City to see us here in Miami. Just to give a little background to the entire world, this patient had surgery 2 months ago. Bilateral second digits, left and right, for the correction of hammer toe deformities.
Yes.
The original surgeon used, for the correction of the hammer toes, implants.
Yes.
2 weeks after the surgery, the patient noticed that her second toes were actually floating off the ground, about 2 or 3 millimeters. The patient automatically knew that something was not, we'll just say, right.
Something was not right.
So the patient reached out to us, you know, with those concerns, and the patient wanted to address the issue ASAP. So today we're going to be bringing down both floating toes, the correction of the floating toes, also the correction of bilateral flexible mallet toes, right? The curly toes. Digits number 3 and 4 of both feet, as well as the shrimp, the hammer toe deformity of the fifth toes, both left and right.
Yes.
Now, I want to be very, very clear with the world. This is something that the patient and myself were just talking about. Even the best of surgeons, the best of the best get complications. It's just bound to happen. The more surgery surgeons do, or the surgeon performs, they will have complications. The good old saying is that you can teach a monkey how to do surgery. You know, what makes a good surgeon a great surgeon? How they handle the complications. Not only how they handle the complications, how they not only address the initial clinical presentation, but from A to Z, from start to finish. That's what it's all about. Okay, so as everyone can see, you know, the second toes are still very swollen from the previous surgery. The area of hyperpigmentation here is normal. So as everyone can see, Caesar, if you can get there we go, the front shot. The toe is actually floating. You see? So we're gonna bring the toe down, you see? We're gonna bring it here, and then we're gonna probably move it right here. The third, fourth, we're gonna go ahead. Okay, bring the foot down, patient. Down. We're gonna go ahead and do that. And then the fifth toe, we're gonna rotate. We're gonna bring it out like this. Really nice, like that. Same thing on the right. This one's also floating. But Dr. Wagner, why is the toe floating? You know, and again, I can only speak on behalf of this particular case. Sometimes these implants are not, they don't sit right. And if they don't sit right, this is what happens. The positioning and the location of the implant is critical. But again, we're gonna be able to fix it. All of these procedures are gonna be performed using our minimally invasive techniques. Office-based surgical suite, local anesthesia, no pin screws, plates, and or implants. So we're gonna put a pause to this, and we'll show you guys the outcome. Okay, everyone, we're all done. All the procedures have been performed accordingly. Caesar, let's take a look here. So in respect to the floating second toes, little incision on the top, same thing here. Excuse me, left and right. Through that one little keyhole incision, we were able to perform what we needed to perform in order to make sure that the toes are now touching the ground. In respect to the third and fourth toes, I want everyone to take a look how straight they are. What I'm gonna go ahead and do now is I'm gonna load the foot, right? And before they were the curly toes, now they're straight. And Dr. Wagner, where are the incisions? Right underneath here. 1, 2, and through this, keyhole incision, we were able to correct the hammer toe deformity of the fifth toe. Just relax, patient. Super. And as everyone can see now, in respect to the fifth toes, nice and straight. Dr. Wagner, where are the screws? Where are the pins? There are none. What we're going to go ahead and do is we're going to splint the toe just like this with a tiny little, what we call a little steri strip for a period of about 3 weeks or so. Okay? Everything looks great. In respect to the right, same thing. Fifth toe was, is, now. Same thing with the fourth, same thing with the third, and the second. The second, some people will notice that the toe now is actually straight. Before, it was over here. Now it's nice and straight. You know, the same principles, techniques that we use for, that we use today for these procedures, toe shortening, minimally invasive bunion correction, hammer toe correction, we use the same principles. How did it go?
It was quick and it was good. No complaints. It was good.
For all the people out there that are watching this video, what would you say to them?
Come get your surgery done, okay? It's worth it. I loved it, and I got beautiful toes now. I loved it.
Just like that?
Yes, and it was very quick.
We will continue to do what we do. Our goal is to educate, to put up, this great content, just to make sure that people do their homework, their due diligence. I will continue to say it. Do your homework. It is important. It is critical. In respect to doing your homework, what are your thoughts?
I should have came to him first. I should have came to him first. Guys, when you choose your surgeon, make sure you really do your homework, because sometimes you would think the best surgeon is, the most popular surgeon, but it's really not at all.
And in closing, I'll just say what I said at the beginning of the video, which is even the best surgeons have complications. Even the best surgeons. If anyone asks their surgeon, have you ever had any complications, and they say no, run. Caesar, anything else? Elizabeth? You guys are very quiet back there. We will continue to do what we do. We're going to continue to educate the world that minimally invasive anesthetic foot and ankle surgery does exist. As always, thank you for watching.